In terms of anxiety, you know, there's the anxiety symptoms that kids have are sometimes they'll tell you that they're anxious or that they're worrying about specific things or that they have diffuse worries. But more typically, the presenting things are going to be things like being fidgety and having trouble paying attention, or being resistant to new experiences and liking things to be the same all the time, or resistance to separation from parents, having fears, either general or specific kinds of things. Also, probably a major group of the kids that you see that in fact have an anxiety problem are kids that appear with somatic symptoms. Those kids that keep coming back with stomach aches, especially on school days, kinds of things. Some of the recurrent headache kids fall in this category, not as many as the recurrent stomachache kids. Or the kids who have difficulty sleeping, especially the trouble falling asleep. That's often because kids are lying in bed going over and over what their worries are about what happened to them that day, or what their worries are about the next day coming up, kind of thing. Kids who wake up in the middle of the night and have trouble getting back to sleep, some of those kids are anxiety things, and some of that is depression symptoms. So it could be either way. Certainly kids with frequent visits to the doctor or visits to the school nurse, that's often because of anxiety. The diagnoses that come out of this can be quite variable. Separation anxiety is obviously that group of kids who have trouble separating from their parents in age-appropriate situations. School phobia or school refusal is largely thought to be an anxiety problem. Specific phobias, so kids who have severe anxiety about specific items like spiders, dogs are the most typical ones, but certainly there are a wide variety of specific things that kids can be very anxious about. I saw a kid the other day who had a phobia about elevators, kind of thing. Social anxiety are kids whose anxiety is confined to social situations. They're fine in terms of other sorts of stuff, but they really have a trouble with the being in a social situation. And generalized anxiety are those kids whose symptoms are much more diffuse and across the spectrum and not confined to one area. Post-traumatic stress disorder is a very specific kind of anxiety where the symptoms are thought to be tied to a traumatic event in their past. And they may or may not be able to articulate that, but hopefully with kids that some adult can say, gee whiz, they had this horrible thing happen to them. So factors that contribute, anxiety disorders, there are multiple factors that contribute, and there's both anxiety disorders, and I want to also reiterate that the behavioral stuff we're going to talk about, you can use it with kids who have anxiety symptoms. They don't need to rise up to the threshold of having a disorder. And a disorder, it would be where their symptoms were substantially interfering with their functioning. But there's a sizable group of kids who are worriers, although they manage to be on this side of the line and they manage to function okay, but it's still causing them some personal distress. So that some of the things we're going to talk about are relevant to that group of kids too. Clearly, the child's temperament plays a factor. There are some kids that things just roll off their backs and nothing bothers them. And there are other kids who tend to be much more sensitive to external things, that they're sensitive to the moods of people around them. They tend to spend more time intrinsically worrying about how their behaviors are going to interface with other people's behaviors, kinds of things. And those are often kids who similarly are sensitive to different foods or the temperature of the room or things like that would roll off somebody else's back. Whether or not kids have coping skills makes a big difference. So there are some kids whose families have worked very hard to shelter them from any trauma at all. Have set things up so they never have to struggle with anything. And one of the problems with doing that is, it's great that you have this blissful childhood, but if you never learn how to cope with things, then you're going to be up a creek. So kids who their parents are always arranging for them to have play dates, so they never have the experience of, what am I going to do with this afternoon of unscheduled time kind of thing, or who carefully arranges that they'll only spend time with other children who are nice, so they never have to deal with somebody who maybe says something mean to them, that those kids don't develop a way of handling things to be able to both handle that specific situation, but then they can't generalize it to other things either. Parental anxiety plays a significant role, and we'll talk some more about this later, and it's not clear how much it looks like anxiety runs in families. A piece of that is probably genetic, and a piece of that is what it's like to grow up with somebody who's always worrying about stuff, and whether that doesn't make you anxious as well, to have somebody always be anxious around you. How the parent responds to the child's anxiety, that there's some parents who quickly rush if the child indicates any anxiety to make things right. So my child is afraid of dogs, so he is never going to be anywhere where there's a dog, kind of thing. It kind of reinforces the yes, dogs are a really scary thing, and you should avoid them, rather than saying, well, you're right, dogs are scary, but some of them are fine. And so let's help narrow down what you have to worry about, because lots of dogs are really nice, and it's nice to have the experience of having interactions with nice dogs, and it's also nice to know when it's legitimately scary to be around a dog, and figure out how you're going to handle that situation. Certainly, the exposure to stressful events makes a significant difference. So kids who've been abused or who witness violence, or certainly there's some studies about kids who are cancer survivors have a PTSD-like syndrome kind of thing. Environmental disasters, so we worry about all those kids who've been exposed to tornadoes and flooding and things like that this year. That's really tough. So things that help out in general to make kids more resilient and less anxious are kids who have regular routines. It helps if your life is predictable most of the time, because then you can devote your energy to handling the narrow thing where it's unpredictable. If all of things are predictable, you're kind of always on edge a little bit of not knowing what's going to happen. On the other hand, if you know that every day you're going to come home and your family's going to have dinner at 6 o'clock, and this routine's going to happen, and then you're going to go to bed kind of thing, and you know who's going to be there and stuff like that, then that's a huge amount of things you don't have to spend your time worrying about. So that helps out. Discussion at an appropriate interval ahead of time about necessary changes in the usual routines. This is a tricky one to advise families about, because the timing is really important. So I was teaching Sunday school one time, and one of the moms whose kid tends to be a little anxious, and the mom tends to be a little anxious, was telling me that they were so excited because she was pregnant. And this kid is 3, and she said she and this kid are so excited about the fact that she's going to have a baby, a baby sister or brother. And I said, oh, when are you due? And she told me 8 months from then. This kid should not have known that his mom was pregnant yet. That's way too long. I mean, he's now going to have 8 months to worry about what are the implications of that. That's not appropriate. So exactly where in that 9-month period he should know, I'm not prepared to say, oh, you should tell all kids at such and such an age, because I think it partially depends on what's going on with the parent. But clearly 8 months is too long ahead of time to know that this event is coming up for a kid that age. On the other hand, you don't want to tell the kid as you're heading off to the hospital of, oh, by the way, when I come home, I'm going to have a new brother or sister for you. That would be too late. So hitting the magic interval, a reasonable amount of time ahead of time, and it depends on the age of the kid and the particular kid, and whether or not there needs to be an explanation of, the one time I think you might say something about being pregnant to a kid is if you're suddenly throwing up every day, because the kid otherwise might think you had some horrible disease, and to know, yeah, no, it's not a horrible disease, it's that happens kind of thing. Sufficient sleep is also really important. David talked about that in terms of, or David or Ken, in terms of ADHD symptoms. There are lots of, sleep is really important. We know that getting enough sleep helps prevent obesity. We know it helps prevent ADHD symptoms in people who don't really have ADHD. And it also helps people who might have a tendency to be anxious to be able to hold things in check. But if you're tired, it's much harder to cope. So it's really important to make sure that people have enough sleep. Nutritious meals at appropriate intervals. I think we sometimes discount how important it is that people have regular nutrition. One of my own children used to be going along fine, and then she'd suddenly lose it and have a temper tantrum when, I think up until she was about 17, until we figured out that she's somebody who really needs to eat at regular intervals, and she doesn't do well if you stretch that interval, kind of thing. And then she'd get more anxious and she'd start to lose it kind of thing. Once she figured out that she was somebody who needed to eat at regular intervals, she started taking along a cereal bar with her when she went places, so that if somebody wasn't prepared to arrange for her to eat, she could arrange to eat, with dramatic improvement in both her anxiety symptoms, but her general behavior kind of thing. So that knowing that is important. Encouragement to try new things. One of the things you want to have is to teach people to handle new things in baby steps. So if people think about trying something new in a setting where they're likely to be successful, and then you can reinforce of, oh, you hadn't done that before, but you tried that, and and either you found you really liked it, or you tried it and you decided you didn't like it, and that's okay because now you know that. Like a new food or things like that, where it doesn't matter whether or not they eat it, because there's some other choices, is a nice time. Then you can reinforce the idea that trying new things is not a dangerous thing to do. And then the other thing is having reasonable expectations for age. Sometimes people are expecting kids to do things too young, and then that tells the kid that when my parent or teacher or somebody asks me to do something, I need to be worried about it because I'm not sure I can handle it because I couldn't handle that other thing. So on the other hand, if people are reasonable about what they ask kids to do, then when they're being asked to do something that's a new or a little bit of a stretch, they trust that this is within their range of things they can do. Giving an appropriate level of feedback for effort. Not making a big deal out of slips, but also not demanding perfection. I see a bunch of kids who, the message I get is, I'm not going to try anything unless I'm sure I can be good at it and I can do it right the first time. But most things in life, you can't be good at them the first time you try them. And there are going to be some stumbles along the way, and there may be some things you try and you don't like. That's okay. But if your family said, when you're 7, if you sign up for that sport, you have to do it all year, and you can't quit till the end of the year, so make sure you really want to do it before I shell out the money, that's not a good thing. They would do better to sign a kid up for something for 6 weeks. And if he doesn't like it, okay, then he can quit at the end of 6 weeks kind of thing. And then, okay, that's one thing you learned you didn't much like, but it needs to be more than the first time, but not such a big commitment that they avoid doing it. Good role modeling about how to handle stresses and new experiences. This ranges everything from, you don't want parents coming home and saying, I had a horrible day, I need that 6-pack, kind of thing, because that's a bad role model. Or parents who say, oh, I'm not going to do that, I'm sure I wouldn't like it, kind of thing. Well, that's setting a bad role model. So providing role models of appropriate things to do, well, gee whiz, I've never done that before, but sure, I'd give it a try, kind of thing. Or I had a pretty stressful day, so I think it'd be a good day to go for a walk after dinner, kind of thing, is a nice role model about how to handle stresses. Good role modeling about assessing risks. Oftentimes you'll find that in families where there are concerns about anxiety, that the parents will jump ahead and have totally unreasonable assessment of risks. You may remember, I don't know, it's getting to be 10, 12 years ago that there was the DC, the sniper shooter. And I had some families who lived not near any main road and lived in northern Baltimore County and decided they were going to keep their child home from school until the guy had been caught. And it was very interesting to think about what that role model was for the kid about the risks of the world, rather than saying, okay, well, it's scary that this is happening, but I'm reasonably sure it's not going to happen to you because we're not in any of the situations that are like where other people got shot, kind of thing. So they weren't even narrowing it down to public places near major highways, which looked like it was primarily what it was, kind of thing. They weren't doing, and then you could say, your chances of getting shot are pretty slim anyway, kind of thing. So you probably didn't need to worry about that. But that was a very powerful message to these kids about how scary the world is, that you have to stay home from school and just stay in the house during this period of time. You also see that in grocery stores where people tell, you're standing in line and you make some, it's much better when people can make nice kind of pleasant chit chat. I've had times when I was behind some people in line and some lady said something of, "Oh, that's a cute bow you have on your head," and then we're like, "Don't talk to strangers," to the kid, and you're thinking, this is not a scary situation. This is just a friendly, innocuous comment, but the message you're giving is the wrong assessment of threat, kind of thing. And then it helps children to think through how to handle unexpected events, so that think about the time when my children were young. I worked part-time, and my goal was to be home before they got home from the bus, so I could meet them at the bus. But I didn't always manage to do that. And so one of the things we did was to talk about, suppose I didn't get home in time. We talked about both, why would that be true? And it would not be that we had a bad crash and my car got wiped out on the Jones Falls Expressway. It would be that I lost track of the time, or my boss had 3 more questions for me before I could leave, kind of thing. And then we also talked about, if you got off the bus and I wasn't here, what would you do, kind of thing. And kind of talk through where would you go and where would be a safe place to wait. And we're thinking that probably sitting on the front step is not the wisest idea. That's kind of a, hello, I'm an abandoned kid kind of thing. But you could go sit on the back porch, or my daughter decided she'd go across the street to the hair salon and visit with those people, which was a reasonable idea. Encourage rational thinking coupled with appropriate caution. So we just talked about the mom being late to pick up the work, or the woman in the grocery store. It also helps kids to think about steps to take when they feel anxious. So if a kid feels anxious, to figure out what are the feelings that you're likely to have when you're anxious, so that before you get to the full-blown, you can say, oh, well, gee whiz, when I kind of have those butterflies in my tummy, or when I'm starting to feel a little jittery, that's probably because I'm anxious, and to be able to put words on it is helpful. Most of those kids who have stomach aches don't have a clue that that's because they're anxious, so they're not making that connection, for instance. To problem solve with the kid about how they'd be more comfortable in a given situation. So, for instance, if a kid's going to a birthday party and they're sitting around worrying about, well, what am I going to do if nobody talks to me? Then you can kind of say, okay, well, if nobody talks to you, what are you going to do? Kind of thing, and how are you going to deal with that? Or to know if you're going into a social event, you don't have to immediately go talk to people, that it's perfectly okay to stand on the sidelines and kind of size up the situation first. And that'd be a reasonable strategy to do. It sometimes helps to ask kids, what's the worst thing you could imagine happening? And then either do that, and how bad would that be? Or if that happened, how would you handle it, kind of thing. So that you help kids develop by talking through that ahead of time. You help put things in perspective, because oftentimes people will blow things way out of and make it a catastrophe, but it's really not a catastrophe. If you arrive at a party and nobody's talking to you, that's not a catastrophe. That just says you need to do something active, that you need to go up to somebody and start a conversation, and then talk about what kinds of conversations do people respond to. It's not a, hi, I'm here, and don't I look beautiful, because that's not going to be very interesting to people, but to walk up and give somebody a compliment, or to ask them a question about what they were just talking about, kind of thing, would be reasonable ways to start that conversation. So one of my kids is intrinsically anxious, and I knew I'd done a good job when she was applying to colleges, and one of the colleges had one of those days where you could go visit for the day. And so I dropped her off on the street corner and said, bye, I'll see you in 24 hours. And she went and found the auditorium where she was supposed to meet with everybody, and she said she sat down in the auditorium and she kind of went, I don't know anybody here. This is kind of awkward. Well, I'm here for the next 24 hours because it was pre-cell phone. I don't know how to reach my mom, so I guess this will be a lot more fun if I have somebody to talk to. So she proceeded to introduce herself to the people on either side of her and to get a conversation going. And she's telling me about it, and I'm thinking, those people don't have a clue that she's an anxious kid. They think this is a really friendly person, kind of thing. And they don't have a clue that all of this came from, I'm really anxious, I feel really uncomfortable. But I know that's the basis for that. They're thinking, this is a friendly, outgoing person, I want to spend time with them. So she ended up having a great time, And I think it's because she'd learned to recognize the feelings, but also to figure out what she was going to do. And it was at that point I knew I'd done a good job with her and her anxiety. The other thing is that it's fine to ask for help or support. If you're in a situation and you don't know what to do, the appropriate thing is to find somebody appropriate and ask them and find out more information about the situation, or ask for some help, kind of thing. So that when I arrived here before Ken had gone down to set up the sign, and I'm kind of there, I don't have a clue where I'm going in this building, kind of thing. But instead of going, oh, this is making me really anxious, I don't know what to do, I went and found some staff on some ward and said, so where in the devil is the auditorium, kind of thing. That was an appropriate way to solve the problem. If I was more anxious or had developed less coping skills, I wouldn't have been out in the front going, oh, should I call Ken and find out where we're supposed to be, kind of thing, and maybe I'm not in the right place. I didn't do that. I went and found somebody to ask for help. It helps to teach these kids some self-calming strategies. So in your handout, you have directions that you can give to parents for each of these. Deep breathing is teaching people just to slow down and concentrate on their own breathing, to do it thinking about moving abdominal muscles and do their breathing slowly. One of the problems when people get anxious is that they tend to take rapid breaths and they hyperventilate. So if you can teach people to slow down and concentrate on their breathing, it helps them calm down. And that's something they can do sitting in school in a test. They can just stop and concentrate on their breathing and get themselves settled down, or before they give a talk. I was at a conference yesterday with 150 people, and I had asked somebody to talk who got up there and went, I've never done this and I'm terrified, kind of thing. But she said, but I'm going to make it through. Deep breath, okay. So she learned that trick of stop, slow yourself down, concentrate on your breathing, and do okay. Progressive relaxation is the one where, and it helps if you're going to do this, to either be sitting or lying down, because if you're going to make things go lax, you don't want to be standing up or you'll be on the floor. But to concentrate on first tensing up muscles and you start with usually extremities first, concentrate on tensing up your toes and then relaxing them, tensing up your feet, relaxing those, moving on to tensing up your lower leg muscles, and then relaxing that, and have the relaxation period go on for at least several seconds, and work your way up, kind of thing. So that helps. And again, that's something, if somebody's sitting in a test and they're sitting, they can do that kind of thing. It often helps that one is especially useful for kids who have trouble getting to sleep, to lie in bed and do it. Part of it is the tensing and relaxing bit, and part of it is the concentrating on that specific activity so your brain is not racing on whatever it is you're worried about. And that's the other piece that helps out with that. Visual imagery is related to that. That's the technique where, and with each of these, it helps if somebody practices these a bunch of times when they're not in an anxious situation. So they get the skill down, and then when they are in something that's making them anxious, it comes to them naturally. They're not going to be able to learn how to do this in the middle of an anxious thing, so they need to practice ahead of time. With visual imagery, what you do is have somebody think about an experience they had that was positive for them, and it needs to be an experience that has lots of sensory components. So the beach is often a useful one. Skiing is another one, or a snow activity is a useful one because there are a lot of things, or being at the lake in the summer or things like that are useful. It can be being at a carnival or a birthday party. It doesn't need to be a serene thing, but it needs to be something that has lots of sensory components and was positive. And then you have them, one by one, think about the sensory pieces they're seeing or feeling or hearing in the activity. So they think about what they could see, and then and concentrate on that for several seconds. And then think about what you're hearing at that experience. In the meanwhile, they're visualizing it in their head. And what can you smell? And what can you taste? And what can you feel, kind of thing. And to run through each of those, and it helps them, if they're willing to practice it out loud about going through what those things are. Sometimes it helps if the kids write down those cues on a 3x5 card and then have them practice running through that several times. This can be remarkably effective, and I didn't realize how effective it was until I had to have root canal treatment. And I was not doing it on purpose. I was lying in the chair, and the guy was having a terrible time doing it. And I found that I was thinking about cross-country skiing, and spontaneously thought about, the snow spraying up, that was the spray coming out of my mouth kind of thing, and I thought about the cold and things like that. And I didn't realize how effective it had been until he asked me a question, and I'm kind of lying there going, he's asking me a question. I should stop thinking about this and answer his question. I really should answer his question, and realized I had basically self-hypnotized myself with thinking about this skiing experience, but it was very effective in not making it nearly as stressful as it would have been otherwise to be able to do that. The other thing is positive self-talk, that oftentimes people with anxiety will talk themselves into things being much worse. They'll sit there and go, I can't handle this, this is terrible. I don't know why I ever agreed to do this kind of thing, rather than saying, okay, I can do this, just take one step at a time, and I can handle this kind of thing. If I get stuck, I know what to do. I'll go find somebody who can help me out, kind of stuff. So encouraging people to give themselves positive messages of, so one of the things I did with my daughter, as she's telling me about her experience at that college thing, was to point out to her, put into words about, do you realize what you've just done with this? And she kind of went, oh, you're right. I said, just think how much easier that first week of college is now going to be, because you know how to do this. And she went, I hadn't thought of it that way. But putting into words about how much she'd learned from that experience that she could then turn around and use another time. With specific phobias, it's helpful to consider the source of the fear and get some details about that. Have the child think about what they would make them more comfortable, and then if it's doable, implement it. So an example of that, if you have a kid who's afraid of the dark, ask them what would make it better. Oftentimes they'll say, oh, if I had a light on. Now, if they say, I want the overhead light on in my room, that's probably not going to be a great. But then you can say, well, gee whiz, the light on in your room may keep you up. Could we do a little night light, or could we leave the light on in the hall and leave the door open? So to come up with something kind of halfway in between that would be appropriate may make it doable, kind of thing. But oftentimes kids will come up with some reasonable ideas, and if the kid comes up with the idea, you've then empowered them to solve the problem, which is a helpful thing, even if you have to tweak it a little bit. It's telling them that they're capable of coming up with some ideas about how to deal with the things that worry them, and that's really important. It's very important not to make fun of kids' fears. The number of parents you see who tell you their kid's afraid of the dark and he's such a baby. That's not useful. That just makes him paranoid about, and thinking there's something wrong with him. There's not something wrong with him. That's a reasonable fear, and he needs some strategies about how to cope with it. It often helps with kids with phobias to help the kid learn more about whatever he's afraid of. It helps narrow down what's scary, and it helps the kid learn how to handle or cope. Probably the best example is either kids who are afraid of insects or dogs. So the kids who are afraid of insects, it really helps them to learn about insects, because in the process they find out that the vast majority of insects are not scary at all. They don't bite, they don't sting, they do nothing, kind of thing. So then you've narrowed it down. There actually are only a small group of insects that you need to be worried about. Those are the ones you should be worried about. The others you don't need to. And then you can learn, what do you do to avoid getting stung by those insects, kind of thing. The same thing is true with dogs. The vast majority of dogs are very friendly and are very nice. Now, even with friendly dogs, there's some things you don't want to do. If you hit a friendly dog with a stick, he might turn around and bite you. But most dogs, are going to be perfectly friendly as long as you approach them reasonably. So having kids learn about how do you tell if a dog's friendly? That difference of if they're barking and the tail is up and waving like this, that's a friendly dog. The tail is stuck down, you better be worried, kind of thing. So thinking about those things that separate it out. Learning that you don't ever try to pet a dog without asking the owner first. A, is the dog friendly? And B, is it okay to pet him? Kind of thing. So learning those kinds of things. And then learning the trick of, that you stick out your hand and let the dog smell your hand first. And then you go to pet him, kind of thing. So the dog feels like, oh, okay, this is a friend. Then you can pet him and things go okay. So learning some of those things will help a kid both learn about how to narrow down his fear, but also some strategies to be able to cope or handle with it. Separation anxiety. With this category, one thing that's important is first to find out if the activity or separation is age appropriate. So if it's something that's pushing it about whether or not the kids should be separating at that point, the answer may be that the parents should back off and not worry about it. I was taking care of a family at one point whose child was 2, and they decided that he should be enrolled in nursery school because they wanted him to have socialization with other kids. But he also had a brand new sibling who was staying home with his mom. And he had bad separation anxiety in nursery school, and it was getting steadily worse the whole first week. And so one of the things we said is, a 2-year-old doesn't need to go to nursery school. Maybe you need, and this is especially stressful with new baby at home with mom, maybe you just need to back off this year and try again next year, kind of thing. Now, if this kid had been 5, that wouldn't have been an appropriate thing to say, because a 5-year-old needs to go to school. A 2-year-old doesn't need to go to school. So balancing those things out. If it is something that's appropriate, the other thing that's important to do is to teach these families to do a short leave-taking ritual, use it consistently, and then leave. Long, drawn-out leave-taking is not useful because it just revs the kid up. But having a short leave-taking ritual is important because then the kid knows, I don't need to worry except when this happens, and then I know they're going to leave, so they don't need to sit around being anxious all of the time. It's also important that those families actually leave and not peer in the window every 5 minutes, because then the kids learn that if I keep my eye out, I can find mom, kind of thing, so they don't ever settle down. It's also important that parents return on time consistently. Sometimes I found that those families where they have the most difficulty with that, the parent is then the last one to return, kind of thing. Again, I was teaching Sunday school, and there was one parent who invariably, her kid had a tough time with her leaving, but then she was always the last parent to come back from church, oftentimes 10 minutes later than everybody else. So I think part of that kid's anxiety about the parent leaving was she was not entirely sure when her mom was going to come back. Much better would have been if that mom had arranged to be the first or second one back every time. And then if you have a kid who's really having trouble with that, it may be useful to have it be a graduated thing. So it may be the first day I'll stay with you, the second day I'll stay with you for half an hour, then I'll leave and I'll come back in half an hour. The third day I'll stay for 10 minutes, I'll be gone for an hour, then I'll come back, kind of thing. But you want that to be fairly short so that the whole process is over in a week at the most. Parental response to child anxiety. It's really important that parents remember to not let their own anxiety get in the way, and to encourage kids to try age-appropriate things and try new things. So I was talking to one of my friends the other day who was concerned about their own child. We were talking grandchildren stories, and they were telling me that they were a little bit worried because their child's child had never been left with anybody, and the kid was now 3. That's going to be a problem, just because, pretty soon the kid's going to actually have to go to school but had no experience with having been left with anybody. Obviously the parent needed to find somebody she could trust to leave the kid with, and she didn't need to be gone for long, but she could just be gone for an hour. But that kid it was time for that kid to have some experience of some separation built in there, kind of thing. Helping children think through how to handle possible situations. As I said, it's really important that kids have the experience of having some low-level stress things come up and figuring out how they're going to handle that. Back when I was at the University of Maryland, our division used to have an annual picnic, which was very awkward because the families came to this picnic, but they didn't know each other. The parents knew each other, but the kids didn't know each other. And by and large, the kids hated going. And so one of the things, my kids tend to be somewhat anxious, so do we have to go? I said, yes, you have to go. It's the expectation. So I said, okay, so you have to go. What would make it go okay? And I said, well, they went, well, maybe if I took something to play with. And I said, even better yet, how about if you take something that you could share with other kids? So they started collecting an LL Bean bag full of things, toys that they were willing to share with the other kids there. So they arrived with their LL Bean bag of various games and things like that, and ended up orchestrating the children's games. Now, I'm sure that nobody realized how anxious my kids were and how the root of this was all in their anxiety. But it ended up that they had a good time. Not all, but many of the other kids also had a good time, which then reinforced oh, this is a good strategy about how to cope. Now, we also talked about the fact that you don't take to these things something that you're not prepared to have get wrecked, because, you don't take your favorite blanket or your favorite doll. You take something that you're willing to share, kind of thing. To be reasonable in your expectations, we kind of talked about this before, that it's important not to expect things to be perfect for kids. Our kids, it's okay to have things not go smoothly and have them realize that they survived it. And equally, you don't need to expect your kids to be perfect. One of my other kids, probably the moment I was most proud of her, one of the times I was most proud of her, is she decided that she was going to try out for soccer in high school. And deep in my heart, I knew, as a freshman, I knew she was not going to make it. She's not that great an athlete. But she decided she was going to do it. And sure enough, 2 weeks into school, she gets cut from the team. And the coach said, she was not the only kid that got cut. Fortunately, there were 5 of them. And the coach said, well, I'm cutting you, but there are some other sports that need kids still, so you might want to think about going out for those other teams. And the other kids all went, oh, I can't do that. And Susan said, well, what's the worst that can happen? We get cut from another sport. We just cut from this one. We survived. Let's all go out for field hockey. So she managed to talk 2 of the other kids into going out for field hockey. They all made the field hockey team and had a great time, probably a better time than if they'd stayed on soccer. And I was so proud of her to be able to put things in perspective and say, hey, it's okay. We survived this. We can survive another one. It's important to praise effort, do a reality check on the parent's own fears, but also to be realistic. If a kid's symptoms are really preventing the kid from doing age-appropriate thing, then the kid may need some formal therapy. So there are formal cognitive behavior therapies that help, especially with things like phobia and stuff like that are really an important tool. Or the kid may need medications. Clearly, several of the SSRIs have a good track record in helping out with severe anxiety symptoms and may be very appropriate. So in summary, you'd use it's a combination of the child's temperament, the child's experiences, the parent anxiety, and their responses to the child's anxiety that contribute to this, and that positive experiences with new experiences and handling glitches helps decrease anxiety and give kids some coping strategies to use in the future. And calming strategies are also helpful. Thank you.